Thank you very much for joining our webinar on pancreatic cancer. I am Anton Bilchik. I'm professor of surgical oncology at the John Wayne Cancer Institute, chief of general surgery at Providence St. John's Health Center. I'm director of the Hepatobiliary Program and director of the Gastrointestinal Research Program at the John Wayne Cancer Institute. We also today have a very special guest, Bonnie, who underwent a Whipple procedure, which is also known as a pancreaticoduodenectomy, one of the most complex operations done to remove a cancer of the head of the pancreas. And she is going to describe what it felt like to be diagnosed, her experience in having to deliver this information to her family, how she processed it, how she managed the surgery, both before and after, and how she is doing today. I think you'll find her quite inspirational. So I'm a surgical oncologist, and I do mostly gastrointestinal cancer surgery, and I have a special interest in the pancreas and the liver. And we're seeing more and more patients with cysts or tumors of the pancreas. Part of the reason is that some patients get scanned for other reasons, and then something is seen in the pancreas, and that immediately leads to a Google search for pancreas cyst, which then leads to pancreas cancer, and then takes you down a very dark path, which, needless to say, may have absolutely nothing to do with you. For example, many patients have pancreatic cysts. They're completely benign. They can be left alone. They're not cancerous. They don't have the potential to become cancer. But I think it's really important to be aware of that Dr. Google can be wrong 70 to 80% of the time when you try and look up what you think you may have. Needless to say, pancreas cancer is one of the most deadly cancers. It's the fourth most common cause of cancer-related deaths in this country. And part of the reason is that most patients, by the time they present, have advanced symptoms, because the symptoms can be very nonspecific, from vague abdominal pain, weight loss, bloating, and jaundice. But the symptoms can be very nonspecific, and so by the time people present with symptoms, the cancer's already spread to other parts of the body, which it clearly puts you in a more advanced stage, and the treatment options are different. So the first question is, if you are diagnosed with a pancreas cancer, and usually pancreas cancer is diagnosed by CAT scan, MRI, endoscopic ultrasound, and sometimes biopsy, is what should you expect at your first appointment with either the surgical oncologist or the medical oncologist. And I think it's important to think about it beforehand, have a list of questions. It really helps to bring someone else along, whether it's a family member or a friend. Often patients just ask to record the conversation, because I think what's very apparent is with when anyone is diagnosed with cancer, there's immediate anxiety, and often what is discussed is forgotten the moment you leave the room. So I think, number one, come prepared. Number two, don't jump to any conclusion. Don't think that because you have a pancreatic cyst that you have little time to live, when in fact you may not need any further treatment. So I think come to the oncologist with an open mind as to what the treatment options may be. Questions to ask your doctor if you or a family member is diagnosed with pancreas cancer. So I think the first question is, are you sure this is a pancreas cancer, should I get any further tests? Do I need any other imaging? Are you convinced this is a pancreas cancer? The second question is, what are the chances that this can be surgically removed versus do I need chemotherapy or radiation up front? In general, if pancreas cancer is localized, meaning that it's contained in the pancreas without any involvement of blood vessels and hasn't spread to any other part of the body, resection is a possibility and cure is a possibility. If, however, the cancer has already spread to blood vessels or to other organs such as the liver, then chemotherapy is generally advised. There's a lot of controversy right now in even patients that are diagnosed with pancreas cancer that can be removed up front as to whether they should in fact get some chemotherapy first. Chemotherapy first has the advantage that a lot of patients don't take a while to recover, and so it may be difficult to tolerate chemotherapy after surgery, and also can potentially shrink the tumor away from blood vessels, increasing the chance of being able to remove the cancer with negative margins. So I think it's really important to be aware that there are many treatment options, and they should all be discussed with you at your visit. Surgery versus chemotherapy versus radiation therapy, and then the timing of each therapeutic measure. The other to ask your doctor is, how do I live my life? Can I continue to work? Should I change my diet? There's no reason to stop working. There's no reason to stop exercising. In fact, several studies have shown that patients that exercise do better, recover quicker, and actually tolerate treatment better. So exercise is really important. Nutrition and diet is essential. There are several studies now that have shown that improving your nutrition, especially patients that have lost weight, improves the outcome after surgery or even during chemotherapy. We recommend in some patients that whose nutrition is not great to actually supplement what they're eating with boost or impact high protein, high calorie supplements which have immune stimulants in them as well. Those have also been shown to help. So exercise, nutrition, and trying to carry on with your life as normal as possible are all essential. The third is to, and you'll hear this from Bonnie, our patient, is to surround yourself with a team of people, whether both doctors that you trust, as well as family and friends. I think family and friends can be of tremendous support and help. You do need to be cautious of the friend that says, I know a doctor somewhere that can do this, or I know someone in Germany that has a cure, or I know, everyone means well, but that can often lead to a lot of confusion. And the third point I would make is, if you can get your treatment close to home, try and get your treatment close to home. I think a lot of people feel that the further they travel, the better treatment they're going to get. And I can tell you that there are many centers around the country that are outstanding places to provide excellent cancer care, and most people do not need to travel very far. So I think these are all important questions to ask your doctor. So I've discussed with you the treatment options. They vary from surgery, which is removal of the tumor, to chemotherapy, to radiation therapy, and often it's a combination of all those treatments that lead to the best chance for cure and prolonging life. The following slides just give you a sense of the anatomy of our body. You can see the esophagus. That's the tube that you swallow through the food goes down the esophagus into the stomach, and from the stomach goes to the beginning of the small intestine, which is called the duodenum. And from the duodenum, it goes into the small bowel, where food is mostly absorbed. The liver makes this green stuff called bile. The bile travels down the bile duct, and bile juices help absorb food. The pancreas is hidden underneath the stomach and very close to the duodenum. It's attached to the second part of the duodenum. And the pancreas does two things. It releases enzymes into the duodenum, which help absorb food. But the pancreas can also releases hormones into the blood, such as insulin and glucagon, which help with maintaining normal glucose levels. The pancreas is divided into a head that's close to the duodenum, a body, and a tail. In this slide, you can see a tumor on your left side, which is in the head of the pancreas. And because the head of the pancreas is so connected to the end of the bile duct, the second part of the duodenum, and the end of the stomach, the only operation to remove that tumor is called a Whipple procedure or a pancreaticoduodenectomy. It's a complex operation because there is a shared blood supply in that area, and it requires reconnecting the small intestine to the pancreas, the bile duct, and the stomach. The surgery typically takes between 4 and 6 hours. It's a safe procedure when it's done at centers that do these operations routinely. It's generally recommended that you go to a surgeon that does at least 5 of these operations a year. On the right side of the screen, you can see the connections when the small bowel is, after the tumor has been removed, and the small bowel is connected to the pancreas, and then the bile duct, and then the stomach. So there's 3 areas where the small bowel is connected. And the operation, as I said, takes a long time, but once the connections are done, there's no reason that you can't live a normal quality of life. This again is another diagram just showing how the pancreas, or what's left of the pancreas, the body and the tail, is connected to the small bowel. It's important to know that when the head of the pancreas is removed, that's generally about 20% of the pancreas. And if you're not diabetic before surgery, taking out that amount of pancreas doesn't lead to diabetes. Some people are diabetic, and obviously the diabetes can be a little bit worse. And some patients have what we call glucose intolerance, and removing some of the pancreas can lead to diabetes. But in general, removing just a small part of the pancreas in the head does not change pancreas function. And hence the reason why after these connections are done, you can live a normal life. You can eat, food goes down the esophagus into the stomach, and then into the jejunum, which is the small bowel, and the green stuff, which is called bile, goes into that same loop as well, as well as the pancreas enzymes. And so it's just a matter of replumbing the small bowel to the 3 organs that the pancreas is attached to. So in pretty much every patient, understandably, that is diagnosed with pancreas cancer, is extremely anxious, as are family members. I think that it really does help to come prepared when you come to your doctor's visit. Bring a family member or a friend. Go to a cancer center, such as the John Wayne Cancer Institute, where we have the ability to discuss your case among our colleagues. We have multidisciplinary tumor boards where we present our cases to other specialists such as medical oncologists, radiation doctors, radiologists. So even though it's just your case being presented, you really are getting the opinion of 30 to 40 doctors. So at the end of the day, you feel like you're getting the most current, up-to-date treatment possible. And also to go to a center that is comfortable doing these procedures with good outcomes. So it's a real pleasure for me to introduce you to Bonnie, who is one of my patients who has graciously agreed to share her story. Bonnie was recently diagnosed with pancreas cancer. She underwent the Whipple procedure. She also has really quite an extraordinary story to tell, and I think it's always helpful for any patient that's just been diagnosed with a cancer such as pancreas cancer to hear from another patient that has just experienced both the diagnosis, the treatment, the interaction with family members, the interaction with doctors, and also what to expect coming in to the doctor's office, what to expect during the surgery, and what to expect after surgery. And also just to better understand the mental aspect of it and what goes through your head and coping mechanisms. And Bonnie really is just someone who's really motivated and has a wonderful story to tell. So please meet Bonnie. Hi, Bonnie. It's great to see you, and you look great.
Thank you. It's great to be seen.
How are you feeling?
I am feeling good. Very, very good.
Which is pretty remarkable because it's only been a couple of weeks since your surgery.
It's true. It's true. I wasn't sure I would be feeling this good by this time after my surgery. But I have increasing energy every day, and I really haven't had any pain or major discomfort for 2 weeks, I would say.
Well, you're months ahead of where I would expect you to be.
Yes, good.
And I think a lot of it is your own motivation and just your willingness to recover quickly.
And I want to do that. Yes.
Yeah.
I like to be active.
Yeah. Well, you certainly have a very different expression on your face than the first day I met you.
Yes, I was terrified, really. Our family experiences with pancreatic cancer had not been good ones.
And that was very apparent. And Bonnie, do you feel comfortable just talking a little bit about your family and what you'd experienced prior to coming to visit me?
Absolutely. So my brother died 22 years ago, before there were really good treatments for pancreatic cancer. And he was not even diagnosed until he was fully involved and it had metastasized to the liver. He had extensive chemotherapy. He was only 52 years old. He had young kids. He struggled every day to be there with his kids, and I was right there with him. I know how difficult the struggle was. Maybe 10 months from diagnosis to end of life. So that is in all our family's mind, of course. But then exactly a year ago, my daughter's mother-in-law had a similar diagnosis. She had the Whipple procedure. It didn't go well for her at all, and she basically never left the hospital. And so, of course, to hear Whipple procedure, my mind was already set against that. And I was like, no, it's not going to have a good ending. But you pointed out to me that I should never compare myself to anyone else. And even when she went into treatment, she was already jaundiced. She was in pain. She was fatigued. Where I'm like this perfectly healthy person, no complaints, saying, wow, am I going to have this big surgery? Because I feel good right now. But your very calm demeanor and the confidence that you exude made me pretty sure that even though I didn't want to, I was going to be having this procedure.
Yeah, and I just so vividly remember the anxiety you were feeling, and understandably, when you've had family members suffer from a cancer that is potentially deadly, and then a complication from being in the hospital from a very big surgery, and suddenly you're having to face this big, huge decision. I think I used the word PTSD, and
Yes.
which I could completely understand, and I think what also struck me about you is that you wanted to think about it, you wanted to process it, you wanted to understand it before even discussing it with your family.
Yes,
with your
I
kids.
did. I felt I needed to have all the facts at hand, and I needed to sit with it for a while. You very kindly recommended that your social worker come in and see me at the end of our talk. His name is Greenberg, I believe.
Yeah.
Yes? Is that his
Yes,
name?
that's right. Very
Yeah.
good, Joseph. Yes.
He was so excellent. And he said to me, before you talk it over with anyone else, you owe it to your children to talk it over with them. And that helped finalize that decision for me. So as soon as I talked to them, they were like, what? No, we're calling Dr. Bilchick immediately. Mom, you're going to do this. It's going to be great. We're behind you. Let's go forward. And things went so quickly.
Yeah, and I think that having at least some support with you when you came to my office was important, because what so often happens, in a situation like this is when a patient comes to talk to their doctor about the potential for a major surgery, there's so much anxiety and concern that often it's hard to process, and it's hard to take it all in. And so having a friend or a family member with you to help walk you through it, or perhaps answer some of the questions that you think you may have heard one way, but really may have meant something else. I think having someone with
Yes.
you is such an important part of visiting with a doctor. And many patients will come on their own, and by the time they've left the office, remember very little about what was discussed. It's just based on the fact that it's so hard to process anything when one feels so anxious. It's and so just doing that is such an important part of the visit. But certainly, I could just, the expression on your face was so telling that you had been through an enormous amount, and just needed a little bit of time to think about this. And also, something else I noticed which is such a typical kind of maternal response, is you're also thinking, well, how is this going to impact my kids, and what are they going to? You didn't want to alert them or make them scared. So you suddenly, you were very protective of your own kids, and that's something that we as parents, it's just natural. But that was the other part that was very telling in our discussion.
Yes. Well, I'm sure it's not an original conclusion, but I am so convinced that cancer does not affect just the patient. It certainly invades the whole family. And I was reluctant in this challenging year that we have had on so many levels to add something else to to the things that my own kids were facing. And my extended family, my sister, my brother's children, I was just irrationally feeling I was responsible for adding something else to their load. I know that it wasn't true, but I still felt that way.
And that's what's made this year particularly challenging. It's not only dealing with the diagnosis of a cancer, but dealing with the diagnosis of a cancer during a pandemic.
Yes.
It really is we've been trying to kind of just find ways of dealing with it since February, March, and on a daily basis things change, and we went through several months where families were or patients were not allowed any family members. They weren't allowed any visitors at all.
Yes.
And that was particularly tough for as part of the recovery, because having a familiar person around really helps with the recovery significantly. So I think patients felt very alone, and in many ways we became the family of our patients.
Yes. That still exists. I'm going to say the support from you and from your fellow, Dr. Nesway, is that the correct pronunciation?
Yes, you have it perfect, yes.
And the incredible staff at St. John's made me feel so cared for and like the top of their list of importance. And from your office, so many visits from your office daily, which I never expected. I just incorporated all of you into my family feeling, for sure.
Well, it's very kind of you to say that. We appreciate that. Bonnie, after you spoke with your kids, how did you feel? Did you feel like a little bit of a burden had been lifted?
Tremendously. Yes.
Yeah, because I spoke with them. You spoke with them on the weekend, and then I spoke with them on the Monday, and
yes.
Clearly they'd given it some thought, and then they said, "Okay, she's ready. Let's go ahead and just do the surgery." And as you know, it's a big operation, and they said, "No, she's ready. Let's just get it done." And that was the Monday, and we happened to have a cancellation on the Wednesday. So we said, fine, let's just go ahead and do it on Wednesday morning, which was 48 hours.
Yes, not even. And I wasn't prepared, but so relieved that it went so quickly.
Yeah. And, and just kind of talking a little bit about the diagnosis of pancreas cancer and what people tend to do whenever they hear about pancreas cancer is the first thing most people do is they Google and will look up pancreas cancer, and it's definitely one of the more severe cancers to deal with. And part of that is because most people, by the time they present, it's already spread. It's already gone to other organs. It's gone to the liver or the lungs or elsewhere. And so really surgery is not an option. The only option is chemotherapy.
Mm-hmm.
And really the small percentage of patients, it's maybe 10-15%, and you fit into that 10-15% where the surgery where the tumor can actually be removed because there was no invasion of blood vessels. And that really is the best chance for cure. And again, the majority of patients don't fit into that category. So it's very hard for any layperson to go on the computer and just look up pancreas cancer and, just see themselves as one of the 90% that really the only option is chemotherapy, and not one of the 10 or 15% where cure is an option.
Yes. You told me not to look on the internet.
Yeah, and that
was your advice.
And I've just seen Dr. Google be be wrong so many times, and it's just we're flooded with data and we're flooded with information, but it's not always. In fact, most times it's hard to interpret. Now, that doesn't mean for a moment that it's not a complex operation and that it's not a bad cancer to have, but when it's localized, you still have a chance for cure, and our goal with you is cure.
Yes, and you said that to me in such an absolutely sure way that I felt at that point there was that possibility. I had not felt that before.
Yeah, and I think that was part of our just part of the preparation, and also just getting your mind wrapped around the surgery and what our goals are.
Yes.
Yeah, and fortunately, I mean, your operation went very well. I think what got you out of the hospital in less than a week was your motivation as well. I mean, I think that it's not just the doctor and the surgeon and the procedure. It's also a large part of it is the patient wanting to get better, wanting to walk, wanting to get out of bed, wanting to get out of the hospital as quickly as possible.
Yes. Although the hospital made it very comfortable for me.
Yeah. So, and I think that that's what certainly, helped with your recovery, was just your motivation to want to beat this and to want to get healthy and well and back on your feet as quickly as possible.
Yes. And I feel like I'm doing that. Yes. And when I asked you, I said, my bedroom's upstairs. Should I move downstairs? You said, no, I want you to go up and down those stairs. I was like, oh, this isn't happening. But yes, it is happening, going up and down the stairs. And, slowly the PT person came and did it with me 2 times maybe. And she said, no, you're good to go. So.
Yes. Yeah, and so you're doing your own PT by just walking up and down your stairs. You realize that?
Yes, but she has me doing all these other complicated walks and.
Good.
Yes, she comes twice a week, so she always makes it a little bit harder each time, as she should.
Well, I think a lot of people, when they get home after a big surgery, think that they should lie in bed, not get out of bed, just be as sedentary as possible. And it's really the opposite that we want. Walking around as much as possible, getting out of the house, going for walks around the block, being in the garden, doing whatever you can. In fact, spending as little time in bed as possible, just using your bed to sleep at night, maybe take a nap in the afternoon. But trying to be as active as possible, because so many studies, again, have shown that exercise is so important, or any kind of physical activity is so important to accelerate your recovery. I mean, you're only a few weeks out from your Whipple procedure, and
yes,
it's absolutely remarkable.
Yes. So I do need those afternoon naps, though, especially after PT. Yes.
Yeah, but that's important. I think your sleep is important. Your naps are important, and also just to focus on what you're eating and when you're eating. It's more about eating the right kinds of foods, because it's very easy as you get further away from the surgery to maybe overeat or not eat the right foods and feel full and get indigestion and reflux. So it still requires some coaching and training your body.
Yes, I have been pretty diligent. No, I have been completely diligent in following the recommendations of the nutritionist, because I want that part to go well too. But I am looking forward to adding something to my diet.
And you can. I mean, that's the I think that, the nutritionists provide guidelines, but starting to introduce something a little bit more exciting is not a bad thing to do. A few bites and you literally start testing your system. It's just, it's almost like starting to exercise and prepare for a marathon again.
Yes. I have a cookie on my vision board. I'm like, maybe at Christmas I'll have a cookie.
Absolutely. So do you have family coming to visit you over Thanksgiving? What are you doing?
Yes. My daughter and her 2 boys will come the early part. They're going home, and then my son and his kids will come the last part of because they're all in school. My grandchildren are all in school. My daughter's a teacher. So they're kind of working around their vacations. I'm looking forward to seeing them.
And how do you, how do you kind of wrap your head around the year 2020?
No, it's been so difficult. It's been so challenging. And yes, every family I know has had their challenges, but our whole family feels, since my surgery and a lot of other things that have gone on in our country that our family is really happy about, we're in like a new 2020 with my good news and continued good news on other fronts that we're more hopeful.
Yeah.
I reconciled, I guess, just to being cautious in terms of COVID.
It also, I think, it changes the way we appreciate things, and don't sweat the little stuff. I mean, we so often get so consumed by the little things in life.
Yes.
They obsess us. They make us upset, make us angry, make us sad, and then suddenly reality kicks in.
It's true. It's true.
So I guess one of the questions that a lot of people ask, if they're diagnosed with a cancer like pancreas cancer, how do they, or how should they approach it? I mean, how, in terms of, mentally, if you had to give if someone called you and said, I've just been diagnosed with pancreas cancer or any other cancer, what tips would you give them?
To choose doctors that you have confidence in, to rely on their information, and to just take it step by step rather than looking down the road at a bigger picture, to follow the science, to quote someone else, but to feel confidence in the doctors that you're seeing and deal with it that way. Of course, your family is a tremendous support. Not everybody has that, but my friends have been amazing also, and I have just felt buoyed by tremendous support and talking about it. And all the doctors that I saw prior to getting to you have kept in constant contact with me, calling me, asking me how things have gone, calling me after they've seen reports. I felt supported in so many areas. And that included your office before I called my kids, because your office knew I was going to do it. And Erica called me twice, just in the kindest way, just saying, I'm thinking about you. I know you have a difficult weekend ahead. All those supports, just take them and incorporate that into your feeling going forward. It's so important, and it's out there for you. It's amazing how people are extending themselves.
Well, Bonnie, I think that what you've just said now is going to be of so much help to so many people that have just been or get diagnosed with cancer, because it's always a shock, and no one is ever prepared. And so just, what you just said now, I think is of enormous value to many people. So thank you for saying that.
Absolutely. I'm so grateful, and I recognize all the assistance I've received along this way for someone who felt perfectly healthy and was so surprised to learn there could be a problem.
Yeah, so Bonnie, do you have any questions for me, since I've been doing all the talking and all the asking of questions?
Not for you specifically, but something I also wanted to say to you is, when I came the morning of the surgery, I had a lovely nurse in the pre-op center who helped me. And as they were putting me on the gurney, she leaned down and said to me, if I had to have this surgery, Dr. Bilchick would be the person that I would choose. That sentiment was echoed by some of my nurses also upstairs post-surgery. It made me feel good. It made my family feel fabulous. Because, of course, we didn't know you, but we did know the doctors that led to you and had great confidence in them, and their confidence in you was certainly not misplaced. So not a question, but really a thank you.
Well, you're gonna make me. I'm trying to keep myself together, so that really makes me tear up. But thank you so much for saying that.
Absolutely. I feel it, and even in this trying time when I was like, I am not going in a hospital with COVID, when they first said, oh, maybe you have gallstones, I'm like, oh my gosh, I'm not having my gallbladder out now. Little did I know that was, further on the line. And I did in fact have my gallbladder out, along with a few other things. But I think you have to take time to reflect on things too.
You do. And, we, as much as, you learn from us, we learn from you. And, although I've been a cancer surgeon for 25 years, every person is different, every situation is different. And, I always find myself learning a lot from the patients that we treat, because it helps us. It helps us in terms of learning and how we educate others, because I think compassion is really important. I think
yes.
Giving you an opportunity to think it through and not feeling like you've got a noose around your neck and that you have to make a decision immediately. I think so many patients think that they have to make a decision on the spot, and that if they don't, that cancer cells are going to be growing, which is really not the case, because a lot of thought has to go into it, and you're much better off spending some time talking with family, reviewing your options, sometimes getting second opinions, and understanding what all the alternatives are, so that you don't feel that noose around your neck, so that when you do make that decision to have a big operation, such as a Whipple procedure, which is also known as a pancreatic duodenectomy, you feel ready, and you feel educated, and you feel like you've got the right support system around you.
Yes, and I certainly felt that. I did.
Well, I've really, this has been one of the highlights of my day, by the way.
Excellent.
So I thank the webinar team for. I've never done anything like this before.
Oh.
I wasn't exactly sure, and I'm not very tech savvy. So for me, just a few clicks was. I felt quite proud that I was even able to do this. But
yes.
It's these moments that I think are really special, and I value the time that you've spent with us. It's not easy to tell your story, especially since it's only a couple of weeks since your surgery. You're still healing, but I think you're a source of inspiration to us physicians and to so many people around us. So
good.
Thank you for doing this.
Absolutely. And I'm happy to share my story, my experiences with anyone who might find it helpful.
Thank you. We're always happy to talk to you. Contact our Gastrointestinal and Hepatobiliary Tumor Center at the telephone number that is provided. And we've also provided our email and website. We would love to hear from you. We're also on Facebook, LinkedIn, Instagram, and Twitter. So this is Anton Bilchik, and it's been a real pleasure having this opportunity through this webinar to communicate with you.
And now for our Q&A, we have Dr. Bilchick.
Okay, do you want to just read them out? Because I don't
Absolutely.
see
So
any...
we had one question that came in is, what are the risk factors for pancreatic cancer?
We don't know the exact cause of pancreas cancer, but there is a higher incidence in obese people. There's a higher incidence in people that are diabetic, smokers, and also there is a possibility of pancreas cancer being genetic in a small group of patients.
So the next question we got was, are there any symptoms for pancreatic cancer?
Okay, so that is a great question because the symptoms can be very vague and non-specific. Many patients have no symptoms at all. Others have some abdominal discomfort, bloating, nausea, pain, and depending on the location of the cancer, jaundice is also a possible symptom if the bile duct is blocked by the tumor itself. So I think any person who has unexplained symptoms of the stomach and is losing weight or just doesn't feel right certainly should see their doctor, and if in fact they have any of the symptoms that I mentioned, pancreas cancer, although it's a relatively rare disease, should be considered.
The next question that came in was, how long does recovery take after a Whipple procedure?
Yeah, so that also is a very good question, because a Whipple procedure is it's a major operation that involves removing the head of the pancreas, the second part of the duodenum, and the end of the bile duct and the end of the stomach, because there is a shared blood supply in the head of the pancreas, and many pancreas cancers present in the head of the pancreas. So the surgery itself can take anywhere from 5 hours to 8 or 9 hours, depending on the size, the relationship to surrounding blood vessels. We try and do the operation with minimal blood loss. We think that it's been shown that if you can avoid a blood transfusion, that's certainly better in terms of trying to reduce the chance of cancer coming back. We also, after the surgery, encourage patients just like Bonnie to be as active as possible. So to get out of bed as quickly as possible, walk around. We have initiated what are known as enhanced recovery pathways. What that really means is trying to eat very soon after surgery. And really, once there is sign of bowel function and a sign that there's no sign of infection, or that a patient can eat, then we send them home. So some people go home in 6 days or 7 days, and some need to be in the hospital a little bit longer than that. It's not uncommon in some people to have what's known as delayed gastric emptying, where the stomach just goes into spasm and takes a while to work. And that can sometimes keep people in the hospital a little bit longer. But in general, the amount of time in the hospital is about a week. And as Bonnie so clearly articulated, we really recommend that anyone going home try and live as normal a life as possible. So walking upstairs is a really good thing. Taking walks around the block in the backyard, taking naps in the afternoon are all a good idea. The whole idea that the whole notion that if you leave the hospital after a big operation such as a Whipple, that you need to lie in bed and watch television all day is really not only a bad idea, but it's going to delay the overall recovery. So everything is geared towards trying to get back to life as normal as quickly as possible.
Great. One other question that came in that pertains to the Whipple procedure is, what are the dietary needs after undergoing a Whipple procedure?
So there are two parts to that. Number one is what you do before surgery. So some people who are diagnosed with pancreas cancer are debilitated. They've lost a significant amount of weight and really need to try and optimize their nutrition through taking nutritional supplements, boost, protein shakes. There's even evidence that taking a drink called Impact for 5 days before surgery accelerates the recovery after surgery. Impact is a drink with a nutritional supplement, but also includes L-arginine, which is a immune modulator, and so it's what happens before surgery, and then after surgery. We usually recommend that patients have a multiple small meals. So rather than 2 or 3 big meals, have a small breakfast, a snack, small lunch, snack, and then a dinner, not too late in the evening, but early in the evening, and then to walk around after each meal. But really to be very aware of monitoring their weight, because it's normal to lose some weight after surgery, and then it's important to plateau and to try and maintain weight. But the whole goal is to get you back to eating a normal diet, a healthy diet that's rich in protein, a balanced diet, and without any obvious restrictions. And most patients will get back to eating a normal diet and living a normal life.
We've got a couple more questions before we wrap up this webinar. One question that came in was, what role does genetic counseling play in pancreatic cancer, and how important is it to do it?
Genetic counseling has become very important in many cancers, and pancreas cancer being one of them. And it's actually recommended that every person diagnosed with pancreas cancer should undergo genetic counseling. Although there are relatively few familial genes that have been identified that are associated with an increase in pancreas cancer, it's important to know who those people are, because potentially they may have other family members that are at risk of getting pancreas cancer. So it's not a high percentage of patients that have familial pancreas cancers. It's not a high percentage of patients who inherit a gene that causes pancreas cancer, but certainly important to know who those people are.
One other question that came in was, what is the survival rate for pancreatic cancer if it's detected early, and then how is that pancreatic cancer screened?
So there is no standard screening test that is used for pancreas cancer, similar to colon cancer, for example, where a colonoscopy is recommended at starting age 45, and the whole point being that if a polyp is identified, the polyp can be removed and can prevent a cancer from occurring, or cancer can be picked up at an early stage, at which point it's curable. There is no screening test that's recommended in the general population. It's really only people with symptoms that I mentioned before that should get a good quality CAT scan or an MRI. Both those tests are very accurate in identifying pancreas cancers. And then there's also another modality, which is known as endoscopic ultrasound. That's a procedure done by the gastroenterologist, where an endoscope is put into the stomach and it's connected to an ultrasound, which can scan the pancreas and identify small tumors in the pancreas, and can also biopsy them. In terms of the survivability, that's a very broad question, because if pancreas cancer has already spread to other organs, obviously the survival is very poor. Not many people survive more than 5 years, but if the pancreas cancer is localized to a part of the pancreas and can be removed completely, and have some additional therapy such as chemotherapy, then the cure rate can be as high as 30%, and clearly there's a significant improvement in overall survival. So it really just depends it depends on the stage at which the patient presents, because early pancreas cancer has the potential for cure. More advanced pancreas cancer doesn't.
Thank you all for your fantastic questions, and thank you, Dr. Bilchick, for joining us today. This concludes our webinar. Thanks.
Thank you.